Hey, I'm hellorodney. Thanks for clicking on my video. I've got a sticker in there every time not every time, but I run my finger and then I have a sticker right there. I guess from the firewood. But I wanted to do a video. I just got through taking down my video. It was like a 30-minute video on my experience with the getting the radiation, taking the radiation pill. I took that video down because I was upset about the way the whole thing went down. So I called this morning. I called the Department of Endocrinology, and I was talking to the person over there. And basically, what happened is the procedure. You know, I thought that in a procedure where you're going to get ready to swallow a pill that's radioactive, that you would have a sit-down meeting with the doctor so they could explain everything to you, and that's not the case. So some of the stuff in that video was things that I made that I thought were assumptions or information that I got from some other source that turned out not to be accurate according to what this person said. So anyway, I took that video down. But there was a person that made a comment on my video. About how in my video I talked about the process, the medical process of, the first time that I've really been a patient. That what I've learned from being a patient is that in order to start the process of healing, you have to have people around you that are compassionate. That I'm not a potted plant that's sitting out in the hallway, and some doctor sends down the order for everybody to put a couple of drops in me of water every time they walk by, the janitorial service or something. That's not who I am. I'm a patient. And patients are a lot different. Medical patients are a lot different than legal clients. This person is a lawyer. They have the word lawyer in their name. You can put any kind of, I could put that I'm a nuclear physicist, but that doesn't mean I'm a nuclear physicist. And now I don't have any reason to believe this person is not a lawyer. I'm just saying, if they claim to be a lawyer, I trust that they are, but I have no way of knowing. But a person put a comment on my video that looks like a lawyerly comment, and basically saying that my feelings are not of any concern. Let me just go and get that. See if I can get that. That comment. Here is the comment. Your feelings, in parentheses, your feelings are not relevant to your treatment. Your charts, numbers, etc. determine what to do, not your feelings, not your questions. It is the same in law. I have 1,000 clients a year, but it is my expertise, not my client's feelings, that matters. You will recover and never talk to that doctor. No, your feelings, in capital letters, no, N-O, your feelings have nothing to do with it. You do not, in capital letters, you do not want a doctor that has great bedside manner but can't treat you correctly. You want an ass that is God with a small g. Now, I don't know if this person watched the whole video, but I think I addressed that in my video, that you want someone that's competent. The first part of medical care is that you have to have the people around you have to be competent. And that is, who am I to say they're competent? I'm just a guy with cancer. How am I going to know if the person is competent? Well, I put that responsibility on the medical board. I put that responsibility on the board. If they've got some doctor that's going in there some surgeon that's going to go in and he's been drinking and he doesn't have on gloves and he's going to perform the surgery with a knife and spoon, then that guy needs to be gone. So and mistakenly, I know in many cases, I make the assumption that because a doctor is there, that he has been approved by the people that make sure the person is competent to do what they're supposed to do. So that's covered. So now, the part about what this person is saying, this lawyer is saying that feelings don't matter. Well, feelings may not matter in the law. You know, if the law says you may not kill your next door neighbor, that's a pretty cut and dried situation. You know, now there's all sorts of little things. Well, why did the guy kill his neighbor? You know, well, he was beating up his kid with a baseball bat. Oh, okay. Well, then there's mitigating circumstances or whatever. But make a long story short, these things can be worked out according to a book of laws. Okay, medical procedures are different. They're practicing. They're trying to do their best. But what I've learned about being a patient is that the way that you're treated makes you feel a specific way. So when I feel like I've been totally slighted and that nobody's thinking about me or caring about me from November the 5th until December the 16th, that has an impact on my healing process. You know, if you feel, it's like if you're married and you feel that your spouse doesn't love you, that's going to have an impact on you. Now, people can say, well, that doesn't have any impact on your well-being as a person because this person takes care of you, provides you with a place to live, with money, with all this other stuff. Well, there's more to it than that. Lawyers are not doctors. The legal profession has never been referred to that I know of as caregivers. Caregivers are physicians, nurses, the staff, these kind of people that are there to help you with your recovery. And part of the recovery process is kindness and generosity and care. That's why they call them caregivers. So, you know, in a cut and dried world, yeah, numbers matters. But in a world where a person's feelings matter, where if a person is feeling like somebody cares and they're like uplifted and they're feeling joyous, they're going to have a better chance of recovery than if they feel like they're just, if they're being treated like a freaking tumbleweed blowing across the freaking, parking lot. There's a big difference. And care is a huge, huge part of the healing process. And it's got nothing to do with law because lawyers are not considered caregivers. Medical people are considered caregivers. It's a big difference. Feelings do matter in your recovery process. I'm hellorodney. Thanks for watching and bye-bye.